In the densely populated areas of Canada, seniors' homes have been finding that they are vastly understaffed and ill-equipped for the pandemic. These homes were not ready for the battle against COVID-19, and it's been long-term care, not hospitals, that have been the epicenter of Canada's outbreak. Looking for answers, I spoke with Dr. Samir Sinha. He's an advisor on long-term care to government and the director of geriatrics at Sinai Health Systems.
You shocked me in the beginning of this pandemic when you said if you had your own parents in senior care, long-term care in Ontario, you would pull them out now. Would you still do that?
I'll be honest, right now, I'm really concerned about the state of long-term care right now. And at the time, I had started sounding the alarm when there were only a handful of homes in Ontario in outbreak. We're now about 150 or close to 200 homes that are now in outbreak across Ontario. And I've been working very closely with the Minister of Long-Term Care, Dr. Fullerton, and the government to try and help the government stay or keep up, if you will, with the science and the evidence that actually says this is what we need to be doing to best support people in long-term care and prevent this virus from getting in and spreading, within homes. But right now, we're not winning the battle. Right now, we know that more homes are continually going into outbreak and people are dying. And so when I actually, if you, Lorna, asked me, as a respected journalist, like, what would you do? People ask me this question all the time, as a doctor, what would you do if this was your family member? I'd say that if you had the ability and could care for a loved one at home, with other supports, then this is something that you may want to consider. And I'll tell you, many families have actually been doing this in Ontario, and it's why the government in Ontario actually changed its regulations a number of weeks ago to support families who wanted to actually do this and who could. The key issue is, Lorna, yeah.
Yes. What is, like, because there are some bottom line things you need to have to be able to take a loved one home.
Oh, absolutely. And I think the key issue, Lorna, is, let's be realistic here. And many of my families, who've actually made the difficult decision by having their loved ones go into care, they didn't do this issue glibly. These individuals need an incredible amount of care beyond, in those situations, what the family could actually provide and what they could do. And so for many families right now, they are agonizing right now in Ontario and beyond, because they're saying, my mom's home isn't an outbreak, but maybe it'll be next. And maybe she'll be at risk of death. And I feel enormously guilty that my loved one's in care and I feel like I can't visit them. I can't do anything more for them. Am I supposed to sit here and wait? And that's why my number one focus right now is saying, how do we at least make these homes as safe as possible? What can we do to protect people in these homes? But for those families, for example, who say, and we have many families who are saying right now, I'm not employed, or right now the kids are home from university, and it's killing us that we can't see our loved one. And you know what? Up until a few months ago or a few years ago, we were doing all the care 24/7 with limited government supports and everything else available. And we actually could do this now. So these are highly personalized decisions. And so one of the things that I've done is to support families across Ontario and beyond in this need, is partnered with the University of Ottawa's hospitals, their Health Research Institute, so Dr. Stacey Dawn there. And we've actually created decision aids for families who are grappling with this decision. And so if you go to Decision Aid and type in Ottawa, if you type in those three words.
We'll put that link right with
exactly
you on the show.
And if
here.
you put that in, exactly, thank you. And if we actually do that, this is how families can go through and figure out what's right for them, because these are not easy decisions, and not every family is going to be able to make this decision. But what we're saying is, for those families who want to, the government has actually made it easy for ones to take their loved ones out of care, not be penalized when it's time to return them to care. I have my colleagues right now who are saying, I'm happy to go in and feed people if that's what they need. I know that I'm a doctor who could do much more highly skilled work, but frankly, right now, it doesn't matter if you have two hands and a brain. Right now, this is the level of care in which we're just trying to connect people and residents with, because that's what the homes are asking for.
Take care there on the front line. Take care, sir.
Thank you very much, Lorna.
Thank you for liking, commenting, and subscribing. What do you think about today's topic? Let us know in the comments.